Now, one of the areas of the body that's affected a lot with people who do CrossFit workout is the shoulder. And so we're going to show you how to do laser treatment around the shoulder to help the joint itself, and also some of the thoracic spine that can cause issues with how the shoulder moves because of its tightness. So Josh, what are some of the things that people will do in with CrossFit that they may feel some problems with the shoulder?
Yeah, a poor overhead squat, which would lead to a poor snatch, and putting the shoulder in a compromised position, trying to get as low as they can. That would definitely put a lot of stress on the shoulder. High repetition workouts with push presses, jerks, anything overhead really could put a lot of stress on it. And then even tons of push-ups, if not done properly, could aggravate the shoulder a lot. I'm
going to show you how I do it from a side lying position. It's a little bit more effective, be able to reach where you need to go. So you can see that he's got some tattoos here as well, and you can use the laser over the tattoos. You may have to move a little bit faster when you go over them because the ink will absorb some of the light. It's safe to use over it, but it may get a little bit warmer when you go over it. So when I treat a general shoulder, I'm going to go and I'm going to support myself from the back here so I can put some good amount of pressure in the front, so there's counter pressure, so if I push back like this, he doesn't roll. Okay? Then I'm just going to use the laser and go right around the front in the anterior capsule, right by the pec minor, which is a big issue on people, in the bicep tendon, bicipital groove, right over the deltoid. And then I can switch hands and then come around the back edge and now get behind the shoulder and hold into the front, okay? And come up on top to get right in the supraspinatus and trapezius, rotator cuff muscle that is an issue, up into the side of the neck and the scalenes. Okay? And if I want to control the arm, I can take the arm up underneath like this, hold it, and then I can actually move the arm in different positions. Internal rotation, external rotation, move it into abduction and adduction as I'm doing some laser treatments as well. Okay? And what's nice about this one is I can still do this one on the side. Okay? But if I want to get into the back edge a little bit, I can have Josh turn over to your stomach for me. And then I can get into his rotator cuff muscle in the back. So come up from under here to get into the infraspinatus, teres major, teres minor, into the latissimus muscle, rhomboids, and if they have tightness in the mid-thoracic spine, maybe there's some restriction in mobility, I can actually do the laser therapy right in here to help loosen up the tightness in the deep stabilizer muscles of the spine. So I can cover a big area to loosen up the controllers of the shoulder. And then obviously you can do just one side if it's bothering you, or you can do both. So now we're going to do a basic stabilization tape job to the shoulder to give it a little bit more control. And I'm going to show you how we can tie it in to give a little bit more feedback and control from the lower trap and lat muscle, especially when they're doing overhead, to make sure they don't keep jamming their shoulder into their ear. So with this one, we're going to put tape across the front, the back, and because impingement syndrome is very common in these type of athletes, we're going to go right over the AC joint with a decompression. But you can put a decompression tape over any part where they have pain or discomfort. So if we're going to go over the front area first, I'm going to lay the anchor point down on the side, and we're going to go at an angle so we can go right over the front of the shoulder. And we want to stretch the tissue, so I'm going to have them externally rotate and turn out a little bit. And then what we're going to do is come right across the front, hook it, loop over, come over the top into the trap a little bit. So I'm right over the pec and the bicep and deltoid. Rub it down to activate the glue. And now we're going to come around the back edge. So I'm going to lay the anchor point down, crisscross over the other one. And then now he's going to bring his arm across, and you can support it from underneath if you want with the other one, or just leave it there. And now we're going to come and follow the line up the back and trail into the other piece right up into the trap. And the decompression is going to go right over the top. So if he had impingement syndrome here, I'm going to tear the tape in the middle Stretch 100%, back off half. Go straight down over the top of that joint. Rub it down. So now he's got better stability and control of the shoulder. And then now I'm going to show you how we can lock in and help the lower trap. So he turns around this way. So we want to anchor this down a little bit more and give some stability here, because people who have shoulder issues a lot of times don't have good control of the shoulder blade itself. So what I'll do is I'm going to put an anchor piece right here on the side of the arm. Then I have him pull his shoulder blades back just a little bit, and this is going to run right down on the side. I can change the angle of the tape, come down on the line of the trap and lat. It's going to give a little stability in through here, and when he raises his arm up over the head, it's going to fire these guys so you don't overuse these. And that's your basic tape job for the shoulder.